There's been a lot of talk about our healthcare system lately, mostly about how many problems it has. It's super complicated and super expensive. Doesn't it seem like we should be doing a better job? The US probably has the best healthcare in the world, but in order to get that care, you have to have really great insurance, and in order to have that, you have to be able to afford it. That's the frustrating thing about our system. The US has all this great research and technology, amazing facilities, brilliant doctors, but because our healthcare is so expensive, all this stuff is hard to access. Or you might think you have really fantastic healthcare coverage until you get sick, or have a baby, or just get older. Then you realize your insurance doesn't cover something, and then you can't afford to pay for the thing that's supposed to keep you healthy. Something just doesn't make sense. Our top-notch American healthcare system doesn't really work for a lot of Americans. In fact, when we look at how it works compared to other countries, the US is ranked 37th in the world. I mean, come on, we're the USA. We should be number one. We have the best landscapes, the best athletes, and the best pie. So, what's wrong with our healthcare? How are we paying so much more and getting so much less? Well, to start, there are still millions of people in the US who have never had health insurance. In fact, thousands of people die every year without it. The way the system is set up right now, everyone who has health insurance is pitching into a pot of money to pay for care. So, the more people pitch in, the cheaper our healthcare. But since not all of us have coverage, the cost to get insured goes up. And even if you do pay for insurance, cost for care can still be astronomical. Nearly 1 million people go bankrupt every year because their insurance doesn't cover everything. People actually ignore their medical problems because they're worried about how much it's going to cost to go to the doctor. Something needs to change, and we can do it with a universal healthcare system. You might have heard other names like single payer or MEDICARE for all, or even talk about a public option. They're all basically different ways of describing the same kind of system. It works by having everyone chip in to one agency, this one single payer that would cover all of your healthcare bills, trips to the doctor, prescription drugs, even grandma's nursing home. Imagine it. Everyone in the country would have the peace of mind that healthcare would be there for them when they need it. It'd be a service you rely on, like the fire department. Hopefully you don't need them,
Anytime.
but they're there when you do.
Anytime.
It can be the same way with healthcare. I know, seems crazy, but actually, it's the way a lot of other nations offer healthcare, so not crazy, just different, and maybe even better. And since the system is streamlined and more efficient with only one payer, it would make economic sense too. All our costs would go down. With our system now, healthcare providers have to use a different form for every different insurance company, all with different codes and different prices for the same procedures. And those prices have been pre-negotiated with insurance companies. Plus, it's pretty difficult to know the price you'll pay for a procedure before you go in. So it's not like you could shop around and see if you could find a cheaper place to have surgery or get your broken arm fixed. In the end, you're kind of stuck with whatever the bill is. With a universal system, it'd be like we all had an advocate who's looking out for us and making sure we're getting a fair price on our care. That advocate would negotiate the cost for a doctor visit, or for drugs, or for a surgery. And she'd have a lot of negotiating power since she'd represent everyone, every single healthcare customer. That means a single set cost that won't vary from place to place. And that means big volume discounts on drugs and treatments. We can collectively save billions of dollars. But the best and most important part is that we'd all have healthcare coverage. Rich, poor, young, old, we'd all be taken care of. So no more worrying if we could afford care. We can all just focus on being healthy. Affordable healthcare coverage for all of us. That's how a universal healthcare system would work. Now, you probably have some questions, but we have answers. Check out this website to learn more.